Is the voice of Indiana County, WCCS 101.1 FM and AM 1160, and our conversation with Dr. Jonathan Scholl and with Sydney Harteis, who is a physician's assistant, brought to you by Marcus and Mack, a law firm representing injured people. Let's say good morning to both of them. Hi, folks.
Hi.
Good morning, Todd.
Joining us from a remote studio here at Renda Broadcasting, Dr. Scholl and Sydney. It's good to have you both with us. We got a lot to talk about. September is Pain Awareness Month, and there are a whole lot of people living with pain, and for some people it's just going to be a fact of life for them, and they have to find a way to manage it. For others, there are innovative and sometimes traditional ways to treat it, and we're going to talk about that with you today. How's that sound?
Absolutely. With Chronic Pain Awareness Month, the Center for Spine and Pain Management is really trying to get awareness out to the community that pain is not part of the normal aging process. But still in the United States, 1 out of every 5 adults suffer from chronic pain every day. And it's the number one cause of disability in America.
That's a tremendous number. My goodness. And a lot of it has to do, frankly, with the things we did when we were younger. And sometimes we get a little bit reckless in our youth, and we pay the price when we do get older. But let's talk about ways that we can manage that pain. And first of all, maybe define the difference between chronic pain and acute pain.
Absolutely. So sometimes when we get injured, we may have an acute situation where we have pain for a short period of time. Chronic pain is defined as pain more than 3 months. When pain in a certain area of your body, whether it's your back, your neck, your hips, your joints, lasts for greater than 3 months, then it's about time to see a physician and see if there's any treatment options and strategies that we can do to help you get over this pain. There's a lot of associated costs with living with chronic pain, such as loss of productivity, that can be avoided if you see your physician and develop a customized treatment plan.
And you're both with the Center for Spine and Pain Management, correct?
Correct.
All right. So tell me what it does, what that institution does, and how it works.
Yes. So we'll see a patient. We'll determine, their pain etiology, what's causing it. Get a good history, do a good exam, do some further testing if we have to, whether that be, further imaging, studies. But what I do also want to point out is even though we are the Center for Spine and Pain Management, we treat a lot of other aspects of pain that aren't just the spine. We do a lot with hips, knees, headaches, neuropathy that patients suffer from. So, even though our name is the Center for Spine and Pain Management, we do a lot of other aspects of care that aren't related to the spine as well.
Do people normally come to you by referral from another physician, or do they just come in?
Both.
Yeah, absolutely. We the majority of our patients come referred by a physician, but we are open to see patients not referred by a physician. What we would do is contact your primary care doctor just to get some notes and some background on your past medical history before you come in. And we'd be happy to see you at our office without a physician referral.
In this day and age, for the last 6 months, it's been difficult for people to sort of get a grip on some of the normal pain issues that they might be dealing with because everything has to do with COVID and everybody's being extra cautious. But full service is available, I know, for you folks right now, and folks can come in and they can visit with you. But you have something coming up. It's a virtual event, and people can actually interact with you at this event. Tell me about that.
Yeah, absolutely. So we're trying to, again, raise awareness for the community, and there's a lot of concerns with the COVID-19 virus in the community and throughout the country. So we decided to do a virtual event. This will be open to the public and a free event. Anyone with a smartphone or a laptop PC or a computer or internet access will be able to join us virtually. We'll be discussing some issues in chronic pain and dealing with how to deal with chronic pain on a daily basis. Also, it'll be an interactive event. We'll have time for question and answer, and I hope that our patients and our people in our community who joined our event will be able to share some of their stories and trials. We'll learn together and grow together.
How do people participate?
So if you would like to participate for this event, you should call our office. Our number is 724-357-8135, and we will send you a link either to your email or to your cell phone. And once you have the link, you just click on the link and it'll directly enter you into the event at this specific time. The event will be this upcoming Wednesday at 6 p.m.
Okay, very, very good. Sydney, you mentioned a moment ago about pain and how not everything that you do is related to the spine, but so much of our pain is related to those nerves in the spine, isn't it?
Yes, very much so. I would say the majority of the pain that we do see is related to the spine, and we have a lot of options for that. Whenever we see a patient, we really try to treat them using multiple aspects of healthcare and not just covering it with meds or doing an injection. We like to add multiple facets of care, whether it be physical therapy, medication management, injections. We do a lot of aqua therapy, massage therapy, and there are a lot of ways we can treat back pain or chronic pain without just one aspect of care. And we have really been focusing on cognitive behavioral therapy as well, because people with chronic pain are 3 times more likely to develop anxiety and depression than those without chronic pain. So we really like to incorporate that as a part of our treatment strategy as well.
Wow, that's a mind-boggling number.
Yeah.
I mean, wow, that's news. and it's good news to have, because people might not understand the connectiveness
Absolutely.
of one issue to another, and whether it is physical pain or whether it evolves into something else. Treating nerve injuries has several different forms, doesn't it? There are different ways to deal with problems that have to do with the nerves in your body.
Absolutely. The nerves in the body can be compressed either in this neuroaxial region where coming from the spine, or they can be a peripheral nerve injury. So it's really what we do at the Center for Spine and Pain Management is everyone's pain, everyone's nerve pain is a little bit different. So we develop a customized treatment plan for each and every patient. This may include nerve blocks, nerve injections, as well as medications called neuromodulating medications that can quiet our nerves and decrease the intensity of a neuropathic pain. But really determining the correct etiology of the pain is crucial to determine a successful treatment plan.
One of the things that we think of, and probably it's a misconception, is that these are things that always strike you when you get to a certain age, when you get to a certain point in your life after you've been so active and now you're starting to slow down and here comes the pain. It's not that way, though, is it? Chronic pain can strike you any time.
Absolutely. It's more people suffer from chronic pain than heart disease, diabetes, and cancer combined. It is really affecting our communities, and there's very good solutions out there. We also do nerve ablations, meaning that we can terminate nerves that are solely sensory nerves that cause pain. When we do that, that can be life-changing for patients who have suffered from back or knee pain and aren't surgical candidates for years. They'll come to our center, we'll terminate those nerves, and they can have resolution of that pain for years to come.
We are talking this morning with Dr. Jonathan Scholl and with Sydney Harteis, who is a physician's assistant at the Center for Spine and Pain Management at the Indiana Regional Medical Center. So September is Pain Awareness Month. What are the things that people need to know about pain and living with it as they move forward in their lives, besides the fact that there are all kinds of different treatment options? I'm sure there are preventative steps that people can be taking at points in their life to help them to not experience some of this chronic pain that they end up with.
Absolutely. I think number one thing I would want people to know is that they're not alone. There's a lot of patients, a lot of people in the community and in our patient population suffering from chronic pain. There are a lot of things that you can do on your own, such as stretching exercises, yoga, core strengthening, back strengthening, and getting your range of motion increased. We talk a lot about aqua therapy with our patients. Essentially, what is nice about aqua therapy is it's that anti-gravity situation where you don't have that weight on your knees or hips, and you're able to get a good range of motion and a quality strengthening of your core and back muscles. So if you have access to a pool or a local YMCA or even a high school that has public hours, those are great opportunities to strengthen some muscles in the areas that can prevent chronic pain from occurring.
In those therapeutic situations, that's one thing, dealing with it therapeutically. But I'm sure when we think about prevention and some of the other things that we can do, that's a part of the whole treatment process as well, isn't it? Teaching you how to stand at the sink when you're washing dishes, things of that nature.
Yeah, absolutely. We really try to highlight weight loss strategies as well. We send a lot of our patients to nutritionists to kind of help them kickstart that weight loss, because that only helps with chronic pain as well as smoking cessation. So there are a lot of things that we try to stress with our patients that can help with their chronic pain long term.
When we think about the Center for Spine and Pain Management, is it a big staff? Are there a bunch of people working there? And I'm sure there's specialized training that goes into it.
Absolutely. So we have 2 providers, myself and Sydney, and we have 2 medical assistants and 2 nurses, as well as 2 secretaries, 1 secretary and 1 office lead. So, we have a multidisciplinary team. We have a LPN, which is a licensed nurse as well. So yeah, we have a very nice team of 6 to 7 people that work together to make your experience as pleasant as possible. We try to be as efficient as we can and decrease our wait times as much as we can as well.
Closing moments of our visit together, we want to revisit that event that is coming next week. It's on Wednesday. It's at 6 p.m. And for folks who want to participate and interact with you folks, what do they need to do?
They need to call our office. Our number is 724-357-8135. After you just tell us that you'd like to participate in the free virtual event, we'll send you a link to your cell phone or your computer. You can just click on that link at next Wednesday at 6 p.m. and you'll be automatically entered into the virtual world where you will experience the virtual event with myself and Sydney.
Jonathan Scholl, Sydney Harteis, thanks so much for being with us today. Appreciate it.
Thanks for having us.
Thanks, Todd.
Having us.
Thanks, Todd.